Hello everybody, Dr. Katka Novakova here. We are in for a treat when it comes to the sunset today. I will show you a peek in a second. And I also really want to share with you some very important updates when it comes to COVID-19, post-COVID symptoms, post-vaccination symptoms. Primarily, what can be done about this that is not spoken about? There are some facts, or Friday facts, that I want to debunk or give you another opinion on. You're going to find that you can search online and find answers one way or another on everything. You know, there's this beautiful article from a gentleman, 18 reasons why I am not going to get vaccinated. And I just found an article that takes every single one of those 18 and says why they are not accurate. So whatever I tell you right now could be seen as that, you know, like somebody says this is correct and I'm telling you this is not. Here's what I want to share with you today. Something that is dear to my heart, and that is patient health and well-being. And what I am seeing over the last few weeks has me be very concerned, to a point where, again, I won't tell you do A or do B, but I am going to encourage you to maybe wait, to maybe reconsider, and I will urge you to look at all the data, look at, listen to the healthcare workers that are the front line or the back line. Remember, please watch the video from yesterday about the back line from the front line, especially if you're a healthcare worker. It is so important that we honor that energy that is currently very, very strong as to patients struggling with the post-vaccination. And I am today more than ever, more than ever in the last few weeks, with the vaccinations being full forward, especially getting the second doses, I'm seeing more and more patients. Number one, they're having post-vaccination symptoms, and number two, they're having post-COVID symptoms worsen after they have been vaccinated. And I'm seeing, this is really important, I'm seeing patients that have post-COVID symptoms worsening even though they are not being vaccinated. This is really important, and it is something that we want to look into and stay really alert to. So before I give you all the facts, and again, the facts that I have come to and researched, and you're going to find other facts that are opposing that. I think at this point it just has to come to common sense and the experience of our fellow humans. I have seen a lot of patients that are exhibiting two primary groups of symptoms. One is inflammatory, and one is nervous system affecting. Usually a regular virus, whether it is hepatitis B virus, whether it is herpes virus, whether it is influenza virus, they have immune system affecting symptoms. I haven't seen many lingering I have seen lingering infections. I have seen chronic infections for sure. Not as many piling up inflammatory and neurological symptoms. So it tells me there's something going on twofold. Again, I don't know. I'm not going to speculate about the origin of the virus. There's something about the virus, whether it's the virus itself or something the virus is carrying, that one is affecting the immune system, meaning, we get the flu-like symptoms, we get the upper respiratory, the cough, although that has to do more with the inflammatory aspect of this. So that one we're going to put in both categories. And then usually the virus takes its course and tends to be complete. Here somehow a lot of people have recovered. A lot of people have had very mild, and that, that's great. And there is a lot, and I see more of those, unfortunately, that had the main, the upper respiratory, they had the fever, chills, they had the loss of smell again, and the loss of taste would fall more into the neurological aspect, because it's the olfactory nerve for the smell, and it's the other nerves in the tongue and the taste, and that has to do more potentially with the inflammatory and with the nervous system conditions. What I want to speak about is the long-term post-COVID symptoms that are, number one, inflammatory, and number two, nervous system affecting, whether it remains, the loss of smell and taste remains, whether people actually get vertigo, whether we have major headache and dizziness, a lot of tingling everywhere, hands and feet, and then a lot of ringing in the ears. That's a very much, one, a neurological symptom, and two, symptom of some kind of form of toxicity. And then we have the prescribing medicine that I see most patients are getting are steroids to actually help to bring down that inflammation. So there's some kind of inflammatory aspect happening in general, and then happening with the nervous system, and then potentially some kind of toxic aspect that is affecting the nervous system. Our nervous system gets easily affected by neurotoxins. That's why a lot of the vaccinations are kind of questionable in general, as far as them causing potentially some neurological, I'll just let you watch the sun, some neurological damage. So I have seen that quite a bit, and it has me kind of pause and see, beautiful, isn't it? And see, what can I do to help patients? And what I have seen that helps the most is combination of few things. One, they still need immune system support, meaning we still need to do something to help the body to fight potential remnants of the virus, number one. Number two, we need to allow for anti-inflammatory support, and then a big time detoxification of the organism and toxin binding properties to help the organism, isn't that beautiful, to move the toxins out. So this is really important. So I have a lot of patients that come, and it's just kind of going to their neurologist. I just got a message today, I had the appointment, they just told me to do steroids. Should I do it? Steroids will help to bring down the inflammation. They will not help temporarily, most likely. They will not help to get out the toxicity and potentially the viral aspect of this still, where the immune system is struggling. So remember, for those of you who have availability to do the ozone therapy, I have just seen some some remarkable actually effects with this, as far as patients turning the corner very fast. With even the minor ozone, the shot that I shared with you with the angistol is number one. If needed, we do the major ozone. If that is available, great. And then some liver support with the glutathione and taurine makes a big difference. If that is not available, let us remember, supplement-wise, we definitely want to have toxin binders on board. So some form of fiber. I love if we can get always a little bit of activated charcoal in there, maybe some diatomaceous earth. Psyllium is not the best, but we can use psyllium, maybe mixed with flaxseed. Really, really good to have on board every night before bedtime. The other thing, we want to have some form of liver support. Glutathione is going to be number one, either the liposomal or S-acetylglutathione. I really like the S-acetylglutathione synergy. I'll make a note for you guys. The reason for that, it has the NAC in it, the precursor, which supports the lungs. So that not only is a detoxifier, it's a huge anti-inflammatory helper, really. So that's beautiful. And then let's not forget, how does our body heal? Going back to basics, truly. Nutrients, whereas the clean water and the high density alkaline nutrients, breath, especially if we have any upper respiratory, we get the extra oxygen in. We got to eliminate. That's where the binders come in. Some form of movement, where we're moving the lymphatics, number 4, and number 5. Even if we give ourselves extra half an hour to an hour of sleep, if we cannot sleep, just lay and rest and breathe in a laying down position. Those 5 aspects come together and one builds on top of the other. So let's remember that nutrients and what we put in our body will either support us or will hinder us and create more stagnation. So that is really, really important. We do have things to do. We don't have to just wait and see. Before the sun sets, I just want to really put out there briefly, I am going to start urging those who have not gone to do their shot number 2 and who have not done vaccinations yet or on it's going to be nice and windy, so I have to do this again, but it's okay, that are in not sure yet what I should do. There is more and more, you're going to see more and more from the media and from the insurance companies, more and more reasons why you should do the second dose and why you need to do the second dose. I have 4 reasons here that I just wrote from Blue Cross Blue Shield email that I want to go with you over, and they're all going to scare us into doing this, right? And I'm going to invite us to look at some other data, such as the ones that are coming out in Lancet of the efficacy of the vaccines that have been given right now, that are very low, very, very, very low. And this is the Lancet coming out of that. This is not somebody making this up. So we have, once again, 2 hugely opposing ideas. Or I can share with you is what I'm seeing after the vaccinations are being done. I'm seeing, again, the same thing, a lot of inflammatory, highly inflammatory, systemic inflammatory conditions, including high tinnitus, dizziness, vertigo, inflammation of the blood vessels. The clotting is one aspect of it, but it's things like vasculitis. I have seen people with actually inflammation of the lungs, where their cough starts getting worse. Especially a gentleman who had the COVID long time, like almost over 6 months ago. He had the symptoms of his lungs not 100% recovering and then getting better. And when he got the first dose, it got worse. When he got the second dose, it got significantly worse. And you're going to see some data coming up that is, first, normal, and second, expected, and third, a good thing, that the body is pulling out the virus and it's healing it. I am going to question this one big time, because I don't see people getting better from that worsening, and I don't see that being beneficial really, because it doesn't make sense when it comes to vaccination. One of the, let's enjoy the sunset, because here's the thing, we always have to come back to what is our truth, because we're going to be swayed back and forwards, left and right, up and down. There is a lot of benefit for a lot of companies with these vaccines that are not always taking the big picture in consideration, unfortunately. And so we just have to stay alert, stay connected to our truth, and always look at both sides. When we get an email from an insurance company, and that email says, make sure you get your second dose because it's harmful if you don't, it's like, except the harm that they mean is you might just be a little bit more happier and do more things and lose guard and then get ill. And I was like, that is not harmful. That is not a word to use. So if I read, in big bold letters it's harmful, and I don't read the little tiny letters explaining why it's harmful, I'm gonna go get a second dose, right? The other thing is that I really was surprised by is the statement that the vaccine side effects are normal and temporary. I have seen nothing temporary about these guys. Quite the opposite. And vaccine side effects to this large extent are, if we're considering them normal, then there's something is not right with what we're doing. Because first do no harm is the number one rule of being a doctor and of medicine. Thank you, Sun, for this beautiful sunset. I mean, look at this, you guys. I hope you get to enjoy it. And I just, the reason I'm putting all this out there for you is not to make it more difficult, is to let you know that there are some things that are not spoken about, and so it's important that we actually ask the people that see this firsthand, like this hospital administrators and workers that do not wish to get vaccinated because they see what they see as a side effect being long-term lingering and much larger than should be expected for any vaccine. And then we understand that it's okay to wait. We also understand that travel-wise, it's not a reason to get a vaccine, because as you see now, the world does not accept the vaccination card. It needs the test regardless whether we're vaccinated or not. Thank you, Sam. That was beautiful. And I think that is very important to honor and understand. So if travel is your thing, this is not a reason. Getting one shot. Oh, and this one is really important. I'm just going to go through all of them that I saw. Oh, the clinical trial. The clinical trial is based on 2 doses. Here's the trouble with the clinical trial. The clinical trial has been so minimal. It is not the clinical trial was approved for, the vaccine has been approved, remember, for emergency use, which means all safety questions go down the drain, and it's just whatever is available and goes. Second dose is needed for long-term protection. This is really important because it is, if there are any post-vaccination symptoms, that are not going away and they're long term, they're gonna get worse big time after the second dose. That's what I have seen, and that this I really urge you here to reconsider getting the second dose if that is the case. We talk about the normal and temporary, that's a big one, but this is a really important one that I want to mention. Okay, getting one shot could allow the virus to evolve into a new variant, making thus the vaccine not really useful. That is really important because that is happening regardless, and you're going to see there are some virologists that believe the opposite. So it's again, where do we choose to put our belief into, and can we trust our body and our intuition and stand by it? It's like this beautiful checkout lady at Safeway last night. You know, they get $100 gift card if they get vaccinated, and every dollar is a big deal. And so she doesn't want to get vaccinated, but it's a tough one, right? Because you're getting an incentive to get vaccinated, but she knows her truth and she's going to honor it. And just again, it's just beautiful to witness. But with this, there is actually some school of thought that believes that because we're doing the vaccination, we're forcing the virus to mutate at a much higher speed, because the virus is kind of like freaking out, trying to survive. So both schools of thought are here, and it again depends where we choose to look. So if I am somebody who has high stake in you getting vaccinated, I'm gonna choose whatever I can to create fear and to have you go get a vaccine and to have you go get a second dose. We do have to, unfortunately, it should not be this way in healthcare. Unfortunately, it is the case, and we need to understand that that is part of this whole thing and take that in consideration. So just like I shared with you during our immune system, just like I shared with you last night, you know, about the boards that we see driving on the highway. We don't see any of that during flu shot vaccine or any other vaccine. So there's more going on here, and all I can do is share with you my experience with my patients, which does have me really pause and think, has me be alarmed, has me be asking myself what else is going on besides there being just a plain virus that I need to look into to be able to support my patients to the best ability, and just stay in my heart as much as I can, and come from a place of love and compassion for anyone, just like I shared with you last night. So look at these beautiful birds. These always come at after sunset. So I hope this wasn't too I want to say the word depressing, but I don't, you know, it's a tough one. It's just there's a lot of pain that is involved in all of this, and if you are interested in my quick share about that, it was a really beautiful one last night, which was the third and about half of our sunset musing. So please go listen to that one, and I just appreciate you being available, and let me know what you need. Okay, take good care, enjoy the beautiful rest of the evening. Bye everybody.